Hello everyone, welcome to my channel. Today I'm going to talk about different structural abnormalities of the teeth like Amelogenesis Imperfecta, Enamel Hypoplasia, Tunnel's Hypoplasia, and Dentinogenesis Imperfecta and types in that, and as well as Dentin Dysplasia, and a little bit about regional Odontodysplasia. So these are the things that I'm going to cover in today's topic. And in case you like my video, please do like, share, and subscribe. And I have also made few videos earlier in oral pathology. And if anyone have any questions regarding that, or you want me to make any new video, you can always leave it in the comments below and I'll get back. So let's get started with today's class. So there are three types of Amelogenesis Imperfecta. Here the picture is of a specific type, that is hypoplastic type. But before that, let me talk about Amelogenesis Imperfecta in general. So mainly in Amelogenesis Imperfecta, what happens is there is defect in enamel formation. So there is a problem in enamel formation. But the dentin, pulp, and cementum are normal. So here, the main finding that you can see is the enamel is very thin, whereas the pulp is enlarged. Okay. Now, there are three types of Amelogenesis Imperfecta. This is very important for the boards. One is hypoplastic type. Another one is hypomaturation type, and another one is hypoclassified type, calcified type. Okay, so what happens in hypoplastic type, that is this one you can see over here, is inner enamel epithelium differentiation into ameloblast does not occur. Okay, so hypo means less, plasia means number of cells. Okay, and hypomaturation means there the maturation is less, and hypocalcified means, what happens is the normal thickness is affected, it is less, and whatever is present is calcified. Okay, now coming to how does it look like. So basically it looks like picket fence appearance can be seen here. Okay, and here enamel is well mineralized and this does not chip. So enamel does not chip. Okay, now coming to hypomaturation type. Here I'm going to write all three at the same place and also show you diagrams so that it will be easy for you to recollect. Now, hypomaturation is, what happens is enamel is normal, but I told you that there is a maturation problem. So matrix is not mature. So matrix is immature over here. Okay, because there is hypomineralization. Now, what happens due to that is there is dental sensitivity. And how does it look is because mineralization is not proper, the tooth, first of all, the easy way to identify is there is loss of interproximal contacts. There is loss of interproximal contacts. And teeth look very small. Okay, and radiographically you can see that it is slightly reduced. Okay, so radio opacity is slightly reduced. So slightly reduced radio opacity. Okay, now coming to hypocalcified or type 3. So this is type 1, this is type 2, and this is type 3. Here what happens is the matrix thickness is normal. The matrix thickness is normal, but it is hypocalcified. Okay. Now, here enamel chips off very easily. Enamel chips very easily. and it is clinically similar to that of hypomaturation. Okay. So it is clinical features are similar that of the type 2. All right. Now, let me show you how type 2 and type 3 look like. So this is type 2. You can see that it is more yellowish and still there is like whitish appearance. And here, hypomaturation means I told you the matrix is not mature, it is immature. And this is hypocalcified. So the main thing you can notice is there is loss of interproximal contacts only in hypomaturation type. Okay, now coming to, let's discuss again once seeing the slide. So Amelogenesis Imperfecta is mainly, let me just write it down for you. So it is a hereditary condition. Okay, now what happens here is there is a defect in enamel formation, but the pulp, dentin, and cementum are normal. There are three main parts mainly. One is hypoplastic type, another one is hypomaturation type, another one is hypocalcified. Sorry, hypoplastic, hypomaturation, hypocalcified. Hypoplastic is the type 1, hypomaturation is the type 2, hypocalcified is the type 3. Now, what happens exactly in hypoplastic type is differentiation of inner enamel epithelium into ameloblasts does not occur. And the appearance is picket fence appearance, and the enamel is well mineralized, so doesn't chip. The chipping of the enamel can be seen only in type 3. Okay. Now, type 2, what happens is the thickness of the enamel is normal, but matrix is immature. It is hypomineralized. There you can see dental sensitivity also. You can see radiographically, enamel is similar radio opaque as that of the dentin. Okay. Now what happens in hypocalcified is the matrix thickness is normal, but whatever matrix is there, it is calcified. Okay, and therefore it chips easily. So this was about the three types of amelogenesis imperfecta. Now coming to enamel hypoplasia. What happens in enamel hypoplasia is mainly it is caused not due to the genetic factors, but it is caused mainly due to the environmental factors. So remember, it is not caused due to the genetic factors, it is caused due to the environmental factors. Next is, you can see that here there is some kind of defect-like thing, right? Yellowish, there is differentiation, demarcation that you can see. So you can see small pits or more, and it affects the entire tooth. Okay, now both deciduous tooth as well as permanent teeth are affected. All right. Next, we have clinical features. What happens in the clinical features is here you can see there is loss of contact. So loss of contact is the thing that you can see. Next, rapid breakdown of occlusal surface can be seen, and main thing that you can observe is yellowish brown stain that appears when the tooth is worn down to the dentin. So we all know the yellow color tint is mainly because of dentin. So here the tooth is worn down to dentin. That's when you notice the yellowish brownish discoloration. Now, see here you can see there is, it is a yellowish brownish color. Okay. Now coming to terminal hypoplasia. What happens in terminal hypoplasia is to the primary precursor. So to the primary precursor, if there is any trauma, then or infection, that particular permanent tooth is being affected. Okay. Now, usually whenever, see here, this specific tooth, you can see that it is different in shape than the rest of the tooth. This is Turner's hypoplasia. Okay. Now, What happens is, if there is any local infection or trauma to the primary precursor, only then you can see it in the permanent tooth. In the first year of life, you can see fever, fluorosis, and nutritional deficiency also can be seen. So nutritional deficiency, A, C, D, calcium and phosphorus deficiency can cause. And also you can notice terminus hypoplasia in premature children or excessive radiation in children. Okay, and this is related to enamel hypoplasia. Now, let me give you a quick recap. So, enamel hypoplasia is mainly caused because of environmental factors, but not because of genetic factors. And here you can see small pits, and it can affect the whole tooth. You can see yellowish brown stain. It means the tooth is really worn out till the dentin. That's when you can see that brownish color. And it affects both deciduous and permanent teeth. And lack of contacts is one of the main thing that you can notice. Okay, this is another picture of enamel hypoplasia. Now, Turner's hypoplasia, this is the small tooth that you can see that is related to enamel hypoplasia. And Turner's hypoplasia mainly happens when the primary tooth has been infected or had any trauma, and that what will happen is will pass over to the permanent tooth and it is affected. It can be caused due to nutritional deficiencies, or if the child has fever in his first year of life, or he's experiencing fluorosis, and mainly nutritional deficiency of A, C, D, calcium, and phosphorus, as well as Turner's hypoplasia can be seen in premature children and the children who are exposed to excessive radiation. Now coming to Dentinogenesis Imperfecta. So, Dentinogenesis Imperfecta, here you can see it is completely brownish, very small, no interproximal contacts. It is completely lost. Like you can see good amount of space in between. So what happens in Dentinogenesis Imperfecta is it affects both primary as well as permanent dentition. Okay. Next is what happens here is enamel is normal, but the dentin is affected. Okay. So enamel is normal, but dentin is affected. Okay. Root fractures are common over here. Next, tooth looks like translucent or opalescent in color. So how does the tooth look? It looks translucent. Okay, and it looks yellow to brown to grayish in color. All right, now the tooth usually looks like a a bell-shaped or a tulip shape. So the crown appearance is usually bell or tulip shaped. Okay, now here we have three types of Dentinogenesis Imperfecta. Dentinogenesis Imperfecta 1, 2, and 3. What happens in 1 is type 1, also known as shield 1. It occurs in conjunction with Osteogenesis Imperfecta. Okay, and here patient definitely has, here the patient has history of bone fracture and also blue sclera. Okay, and here you can see the tooth is bulbous crown with a short root. All right, and the color is amber color. I'm just trying to write it down in the same box so that it's easy when you try to revise it. Okay, so you can see bulbous crown and short root. Okay, so type 2 is Dentinogenesis Imperfecta type 2 or shield 2. So it is shield 1, this is shield 2, this is shield 3. Okay, in shield 2, it is not related to Osteogenesis Imperfecta, and here both primary and permanent teeth are affected. Okay, and it is not related to osteogenesis imperfecta. Dentin is very thin and the pulp is large. Okay, now in dentinogenesis type 3, also called as Brady-Wine type. Brady-Wine type. Okay, here you can see multiple pulp exposures. Multiple pulp exposures can be seen. Okay, and remember one thing, usually in Dentinogenesis Imperfecta type 3, you can always see a periapical radiolucency. Okay, so here you can always see a periapical radiolucency, and the teeth will look like shell-like appearance. Okay, so teeth has shell-like appearance. So here, forget this diagram. This is for Dentin Dysplasia. I was about to draw about the pulp, and I don't know why I have drawn a periradicular cyst. So that doesn't come here. So let me just erase it. So till then, I hope we can have just a revision till whatever we have studied till now. So we have studied that Dentinogenesis Imperfecta. Dentinogenesis imperfecta occurs in primary and permanent dentition. Enamel is normal, dentin is fragile, so root fractures are normal. Tooth is translucent or opalescent in appearance, yellow to brown to gray. Okay, and the shape is bell or tulip shaped. There is excessive constriction at CEJ. Now you have three types of dentinogenesis imperfecta. One is dentinogenesis imperfecta type 1, type 2, type 3. In type 1, you can see that it occurs in conjunction with osteogenesis imperfecta. Patient definitely has a history of bone fracture and blue sclera, and the color of the tooth is amber colored. Okay, now dentinogenesis imperfecta type 2 or shield 2 is not associated with osteogenesis imperfecta. It also occurs in both primary and permanent teeth. And remember one thing, the dentinogenesis imperfecta type 1 has a bulbous crown and a short tooth. Okay, and type 2, primary and permanent teeth are affected. Dentin is very thin and roots are enlarged over here. Okay, so the roots are enlarged. All right. Next, dentinogenesis type 3 or Brady-Wine type is mainly, here you can see multiple pulp exposures and teeth look like shell-like appearance. Now coming to regional odontodysplasia. These are also called as ghost teeth. Okay, it is nothing but localized non-hereditary abnormality. So it is localized non-hereditary abnormality. Okay, that has adverse effect on all structure. So it affects all structures. Okay, and it affects primary as well as permanent tooth. All right. So let us just have a quick review on all the structural defects we have studied till now. So Amelogenesis Imperfecta. Amelogenesis Imperfecta, I've told you that here the enamel is thin, pulp is enlarged. It's a hereditary condition. What happens over here is there is defect in enamel formation. Pulp, dentin, and cementum is normal. There are three types, mainly hypoplastic, hypomaturation, and hypocalcified. So in hypoplastic type, the inner enamel epithelium does not get, there is lack of conversion of IE into ameloblast. Picket fence appearance can be seen. Enamel is well mineralized and doesn't chip. The only chipping part you can notice it is in the hypocalcified type. Hypomaturation type, type 2, normal thickness of enamel, but matrix is immature, hypomineralized, and dental sensitivity can be seen. And radiographic appearance is actually enamel is similar radio opacity that of the dentin. So here radio opacity is similar that of the dentin, and I've written other way around. And for type 3, it is reduced radio opacity. Okay. Now this is hypomaturation type. Hypomaturation type, you can see there is a difference over here. And in hypocalcified, it is more yellowish. And here the matrix is calcified. Now coming to enamel hypoplasia, it has no role with any hereditary conditions. It's mainly related with the environmental factors. You can see small pits or defects that will affect the entire tooth. Clinical features is you can see lack of contacts, rapid breakdown of occlusal surface, yellowish brown stains. You can see in almost all the tooth in that picture. It means the tooth has been worn out in the dentin. Next is Turner's hypoplasia is related to enamel hypoplasia. Here what happens is if there is local infection or trauma in the primary precursor, it affects individual permanent tooth. First year of life, you can see fever, fluorosis, nutritional deficiency. In kids who are having all these infections or fever in the first year of their life, they are prone to have Turner's hypoplasia. And also it can be seen in premature children and excessive radiation in the children. Now coming to Dentinogenesis Imperfecta. Dentinogenesis Imperfecta can be seen in deciduous and permanent dentition. Enamel is normal, but dentin is affected, and root fractures are very common. Here you can see yellowish to brown to gray tooth, and the tooth crown structure is more like a bell or a tulip shaped. Tooth is translucent, and there are three types: Dentinogenesis Imperfecta type 1, 2, and 3. Type 1 is shield 1, type 2 is shield 2, type 3 is Brady-Wine type. Next, we have how do they look clinically? Clinically, type 1 looks bulbous crown with a short root, and it is always associated with osteogenesis imperfecta, and the patient has a history of a bone fracture and a blue sclera. Type 2 is not associated with osteogenesis imperfecta, and here primary and permanent teeth are affected. Dentin is very thin, pulp chamber is not affected, but the root is completely enlarged. And type 3 Brady-Wine type is multiple pulp exposures can be seen, and periapical radiolucency teeth with shell-like appearance, also known as dentin shells, can be seen. Okay. Next, I have explained you about regional odontodysplasia, which is localized non-hereditary abnormality, which basically affects all the structure, and it can be seen in primary and permanent teeth. So another thing that is important and I want to discuss is dentin dysplasia. So coming to dentin dysplasia. What happens in dentin dysplasia is it is an autosomal dominant disease of the dentin that is not related to dentinogenesis imperfecta. So we have studied that, Turner's hypoplasia is related to enamel hypoplasia, but dentin hypoplasia is not related to dentinogenesis imperfecta. Okay, it affects both primary and permanent dentition. All right, now there are two types of dentin dysplasia. One is radicular dysplasia, dentin dysplasia. Another one is coronal dysplasia. Okay, radicular dysplasia means it affects permanent and primary tooth. Now here what happens is in the radicular, the main thing is you will see that there is a radicular cyst associated with it, but the crown looks normal. Crown looks normal in color and shape. Okay, but you can see that there is increased mobility. Now coming to coronal dysplasia, color of the primary tooth is opalescent and permanent tooth is normal. So in the primary tooth, you can see that color of the tooth is opalescent, and that of the permanent tooth is normal color. And here you do not see any periapical radiolucency, no periapical radiolucency. So here you can see that roots are very short. Roots are very, very short. Okay, and pulp chamber is box shaped. Okay, and there is obliterated pulp chambers, and you can see fragments of pulp, also known as chevron. That's why it's also called as chevron's pulp. So dentin dysplasia, it is an autosomal dominant disease of the dentin that is not related to dentinogenesis imperfecta. It affects both the primary and permanent dentition, and it is of two types, radicular dysplasia and coronal dysplasia. Radicular dysplasia, it affects primary and permanent dentition, and clinical features: crown looks like normal in color and shape, teeth has more mobility. Coronal dysplasia, color of the primary tooth is opalescent, permanent tooth is normal. Here you do not see any periapical radiolucency. You can see that roots are extremely short, and you can notice obliterated pulp chambers, and the fragments of the pulp is also known as chevrons. Okay. So just give me a second. So here I have written about enamel hypoplasia. So just let me write here itself about dentin dysplasia. Okay, here you have radicular type, and here you have coronal dysplasia. Okay, just remember that here radicular type you can see radiolucency. Here you do not see any radiolucency, but here mainly the pulp, I'm sorry, I said that chevron's pulp is seen in coronal dysplasia. It is thistle-shaped tube-like pulp that is seen. Okay, here everything is similar like type 1. That's the reason I have written this over there. Everything is similar, but only thing is pulp chambers appears like thistle tube appearance. So it is thistle tube appearance with pulp stones. Okay, here the roots are extremely small, and it is the pulp is box shaped. Okay, so that is about it for today. I hope you have understood the class, and in case you have any questions, please do let me know in the comments below. And if you want access to the slides, also let me know. I'll be more than happy to share it. And thanks for watching, and stay tuned to my channel. Thank you.